Complications of diabetes. Let's begin by understanding the scope of diabetes complications. Managing diabetes isn't just about controlling blood sugar. It's about preventing the serious complications that come with it. Today, we'll explore both acute and chronic complications to empower better health decisions. Diabetes significantly increases the risk of premature death. This figure underscores the importance of effective management to reduce severe health outcomes. Through awareness and proactive care, many of these risks can be minimized. Diabetes complications are categorized into acute and chronic. Acute issues, like hypoglycemia or diabetic ketoacidosis, happen suddenly and can be life-threatening. Chronic complications, such as nerve damage or heart disease, develop over time, highlighting the need for continuous care. First acute complication is hypoglycemia, or low blood sugar, is identified through symptoms, and when glucose levels fall below 3.3 millimoles per liter. It's vital to recognize early signs like dizziness, sweating, palpitations, hunger, or confusion to take prompt action. Glucose is the first aid for low blood sugar. For alert individuals, oral glucose sources like juice or candy work best. For those confused or unconscious, injectable options like glucagon are crucial for safety. Second acute complication, diabetic ketoacidosis, or DKA, develops when blood glucose exceeds 11 millimoles per liter, ketone levels rise, and blood becomes acidic. Early recognition of these symptoms can make a life-saving difference. DKA requires urgent medical care, including fluids, insulin, and electrolyte correction. In some cases, anticoagulants or antibiotics may also be necessary to manage complications. Third acute complication is hyperosmolar hyperglycemic state, HHS. Often occurs in type 2 diabetes. It involves extremely high glucose levels above 33.3 millimoles per liter and dehydration. Seek immediate care if fatigue or confusion arises. Fluids are the cornerstone of treating HHS, alongside insulin and anticoagulants. These interventions, sometimes in an ICU, can prevent severe organ damage. Now, let's pivot to the long-term complications of diabetes and how consistent management can help prevent them. Chronic complications affect both large and small blood vessels. These include heart disease, retinopathy, kidney damage, and neuropathy. Routine monitoring and timely intervention are key to reducing risks. Now let's focus on macrovascular complications, specifically how diabetes contributes to heart and vascular diseases. Diabetes doubles the risk of heart failure and other cardiovascular diseases due to factors like hypertension and obesity. Managing these risks with lifestyle changes and medications is essential for heart health. Evaluating factors such as obesity, hypertension, and smoking helps predict cardiovascular risk. Tools like 10-year risk calculators guide personalized prevention strategies. Blood pressure control is vital for those with diabetes. Patients with high cardiovascular risk should aim for levels below 130 per 80 mm mercury, while others might target below 140 per 90 mm mercury. Moderate or high-intensity statins reduce cardiovascular risks in diabetic adults based on age and other risk factors. Adding medications like ezetimibe may further improve outcomes for high-risk patients. Individuals with existing cardiovascular disease benefit from high-intensity statins and possibly additional medications to maintain LDL cholesterol at safe levels. Next, let's examine complications like retinopathy, neuropathy, and nephropathy, which are rooted in small blood vessel damage. Annual eye exams are vital for detecting retinopathy early. Even with diabetes, good control and regular monitoring can help preserve vision. Simple tests like vibration or pinprick sensation checks can detect nerve damage early. Managing this with glycemic control and proper foot care reduces risks of serious complications like ulcers. Monitoring kidney health annually through tests like UACR and eGFR ensures early detection. Medications like SGLT2 inhibitors can protect kidney function in early stages. Patients with advanced kidney issues, reflected by an eGFR below 30, should see a nephrologist. Continuing treatments carefully can stabilize renal health. New challenges in diabetes care, such as novel treatment, require continuous learning and collaboration between patients and healthcare providers. Thank you for watching. With knowledge, we can turn challenges into opportunities for better health outcomes with diabetes. Please subscribe to our channel to support more health educational videos.